Hello, everyone. Thank you for joining our session, which is entitled The Future of Infectious Disease Research Institutions. In keeping with the theme of this symposium for this session, we've brought together some incredible thought leaders, all from different types of research organizations that span science R&D, capacity building, policy, etc. And we've asked each of the members of this committee to tell us a bit about who they are in terms of their organization, opportunities and challenges. So short slide presentations will occur from each of them. But I'd like to start by introducing our panel. Let me start with myself. For those who were able to come on earlier, I'm Larry Schlesinger, President and CEO of Texas Biomedical Research Institute, the host organization for this international symposium. I'm trained as a physician and internist, infectious disease subspecialist, and I'm also an active physician scientist who's very interested in airborne infectious diseases, in particular known for our work in tuberculosis. I spent about 30 years in academia at university medical schools before joining Texas Biomed in 2017 as president and CEO, where we have galvanized the Institute and its resources to focus on eradicating infectious diseases. Joining me today are Peter Kilmarx, who's an expert in infectious disease research and HIV/AIDS programs and policy, and has served since 2015 as the Deputy Director of the John Fogarty International Center at the US NIH. Dr. Kilmarx previously held a variety of leadership positions at the CDC since 1996. He's helped lead CBC Ebola response efforts in Sierra Leone, Guinea, and the Democratic Republic of Congo. Welcome, Peter. Next is Margaret Gyapong, a medical anthropologist by training. Professor Gyapong is the director of the Institute of Health Research and coordinator of the Center for Health Policy and Implementation Research at the University of Health Allied Sciences in Ghana. The center was designated as a WHO TDR satellite training center for implementation research in 2018. Welcome, Margaret. Next is Dr. Bruce Gellin, who is president of global immunization at the Sabin Vaccine Institute. Dr. Gellin previously served as the Deputy Assistant Secretary for Health and Director of the National Vaccine Program Office at the U.S. Department of Health and Human Services, where he was principal advisor to the Assistant Secretary for Health on vaccine and immunization programs and policies. Dr. Gellin has also represented HHS as a technical and policy advisor to the WHO with a focus on influenza and vaccine hesitancy, and as a contributor to decade of vaccine collaboration and the Global Vaccine Action Plan. He's currently a member of the WHO Working Group on Influenza. Welcome, Bruce. And finally, Jüerg Utzinger is the director of the Swiss Tropical and Public Health Institute and professor of epidemiology at the University of Basel. His research, teaching, and training interests pertain to the epidemiology and integrated control of neglected tropical diseases and health impact assessments of large footprint projects in low and middle income countries. He's engaged in transnational global health research consortia with ongoing projects in China, Cote d'Ivoire, and South Africa and Tanzania. Welcome, Jüerg. And so I would like to begin the presentations today. So I'm going to share my slides. So let me open by describing Texas Biomedical Research Institute. We're a nonprofit institute in San Antonio, Texas, with approximately 370 employees and a core group of scientists, technical support, and staff. We've been in existence for 80 years, and with this 80-year history, we've been focused on research and development in a number of different areas. But our current mission of Texas Biomed is to protect you, your loved ones, and our global community from the threats of infectious diseases. And we've been in this direction now as a focused institute since 2017. Now, Texas Biomed is rather unique in the nonprofit sector. We're the only independent nonprofit infectious disease research institute to combine the following: We have 7 high containment, that's BSL-3 and BSL-4, biocontainment safety level 3 and 4, laboratories and experience in regulatory science, that is with a QA and QC division, required for FDA approval of drugs and vaccines. We are one of 7 national primate research centers in the US and the only one that's situated on the campus of a nonprofit institute as opposed to a university. We have a long-standing entrepreneurial culture with a vision to propel discoveries in basic science through the pipeline from bench to bedside effectively. And we have a history of success. Many years ago, we pioneered in our National Primate Center the development of the first neonatal ventilators, which are now used worldwide. We were involved in the preclinical studies in the first approved Ebola treatment and vaccines that have now been used in Africa, both in Western Africa and the DRC. We were involved early in the preclinical space in the development of curative therapies for hepatitis C, working with a number of our industry partners. And in the setting of COVID-19, as I'll show you in a moment, we've worked with a number of different industry partners, and in particular, early on, began our strong partnership with the Pfizer company to bring the COVID-19 vaccine to market, help bring the vaccine to market. I'll show you that in a moment. Over the years, we're well known for our development of innovative animal models for the study of infectious diseases. And as a National Primate Center, we have a number of different types of primates that allow us to study infectious diseases in a variety of contexts, including metabolic disorders and aging. We have a major emphasis in global infectious disease threats with strong programs in HIV, TB, malaria, hepatitis, hemorrhagic viruses, and more. I want to give you an example of how our institute operated in the setting of the COVID-19 pandemic. So beginning in March of 2020 and working as scientific programs as opposed to siloed departments, we brought together an eclectic group of scientists right away and decided that we were all in since this was in accordance with our mission. And we decided that our lead efforts would be in developing validated animal models for COVID-19. We went out to our philanthropic community and were able to raise within 2 weeks $5 million to launch very quickly our animal model study. So it wasn't a matter of waiting for grant submissions, et cetera. We had the resources and we could begin our live animal studies with COVID-19 on site in March. By May, we had established 2 large animal model primate models for COVID-19 and 2 rodent models. And we were already beginning to write papers. Shortly thereafter, we began our partnerships with Pfizer, with Regeneron for their monoclonal antibody cocktail, Novavax, and other partners on therapies and vaccines for COVID-19. Those studies then began, and we've done a number of studies with our Pfizer partner. We did at least 6 studies, and these really helped frame and focus the clinical trials that went on with the Pfizer vaccine. Again, we completed our more papers, 10 or 15 papers by August, and we were very pleased that emergency use authorization occurred for both the Regeneron monoclonal antibody cocktail and the Pfizer by December of 20. Just an incredible pace of discovery to application that occurred in the setting of COVID-19. We currently are involved in 47 different studies related to COVID-19 alone, in addition to the other research that we have at the Institute. So in my last slide, I want to talk about what I see as challenges and opportunities. We're each going to share this type of vision and then have good, robust Q&A on these topics and hope for audience participation if we've raised some ideas for you. There is no doubt that these infectious disease threats, like the current pandemic, are increasing, with an estimated 80 new viruses since the 1980s and a tripling of outbreaks since the 1980s. This is not a problem going away. It's a problem that's increasing and one that we need to be much better prepared for. We have, in a sense, a perfect storm. We have an incredible problem with growing antimicrobial resistance, AMR, in a number of different microbes. As a global community, we're aging. And aging has itself an abnormal immune response, which leads to more susceptible hosts for infectious disease, which leads me to what I like to talk about, which is the triad of infectious disease, which is infection leading as a trigger, leading to us having a host response of inflammation, immune responses, sickness, and that can trigger a variety of other diseases, brain, cardiac, kidney, etc. And we're learning about this triad again in the setting of the COVID-19 pandemic. And we have pockets that are increasing of high intensity interfaces between human, animal, and the environment. And we know that so-called zoonotic pathogens that travel from animals to humans represent a pretty significant problem when it comes to infectious disease outbreaks. And we have the new challenge, of course, that we talked about earlier today, and that is the politicizing of public health and the rapid miscommunication campaigns that can go on as we're all on our mobile devices reading everything that's published very quickly. And there is a need, a definite need for more and more education in the setting of infectious diseases. And finally, if we look at history, we've been reactive to these infectious disease challenges. And when you're reactive, you can never really catch up. Even though science did incredibly well in this current pandemic in 11 months, going from sequencing the virus, the genetic code, to a shot in your arm, still our challenges continue with regard to this pandemic. And as is a theme emerging in this symposium, more public-private partnerships with individuals from various organizations leaning in and starting to talk to each other about different platforms that will enable us to more rapidly design, develop, and implement strategies to avert infectious diseases. We need specifically to close the gaps between research and development, manufacturing, delivery, and field work, and increase capacity in a number of these sectors. And finally, I believe that we need greater and greater awareness and intersection of the threat of infectious disease and public health infrastructure in general. And with that as a start, I would like to now move to our next speaker, and that is Peter Kilmarx.
Wonderful. Thank you, Larry. I'm just sharing my screen and just want to really thank you, Larry, and organizers for the invitation to be part of this distinguished panel, and congratulate Texas Biomed on your 80th anniversary. So I will talk about the U.S. National Institutes of Health, and just starting with the mission, it's to seek fundamental knowledge, so the basic science research about the nature and behavior of living systems, and the application or translation of that knowledge to enhance health, lengthen life, and reduce illness and disability. There's 27 institutes and centers at the NIH, and it's the largest funder of biomedical research, public funder of biomedical research in the world, with a budget now at nearly $43 billion, the annual budget. And I will emphasize that there's a very strong commitment to global research at the NIH, particularly under the leadership of the director, Dr. Francis Collins. We really see unique scientific opportunities around the world. Infectious diseases, particularly where they're more prevalent in other countries than in the US in many cases. Genetics, the greatest human genomic diversity is in Africa. Environmental exposures, many other scientific research opportunities through global collaboration. There's currently over 12,000 active international collaborations supported by the NIH. And in a recent analysis, we found that of all the NIH funded publications in 1 year, 35% of them had one or more co-authors that had a non-US affiliation. So it's really a global enterprise, the NIH research in general. At the Fogarty International Center, we support NIH and all the global partnerships. We strengthen capacity in developing countries, and we're training the next generation of scientists, which we've been doing for over a generation. So there's now more than 6,000 trained worldwide. We're very gratified to see some of the NIH trained former trainees and grantees taking leadership roles in the COVID-19 response in their countries, in their regions, and globally. We have over 400 current ongoing research and training projects with more than 100 different academic institutions around the world. This is very diverse. It's not just infectious diseases, it's also non-communicable diseases, environmental health, bioethics, mHealth, implementation science, and other areas. So there really are great challenges and opportunities in global infectious disease research. We've seen, as Larry mentioned, really unprecedented collaborative global research response to COVID-19 with these amazing breakthroughs, but also there's an unfinished agenda doing the pathogen genomic surveillance and antigen updates to the vaccines. And is one, another would be really characterizing the so-called long COVID and developing therapies for that. From our perspective, we've really seen, again, the importance of research capacity as an element of preparedness, of pandemic preparedness. This was in a report from the World Bank called Money in Microbes, where they articulated that actual clinical research capacity should be considered an element of pandemic preparedness at the country level. We see great disparity in research capacity. This was an issue with the products that Texas Biomed helped to develop in the Ebola research in West Africa, the delays in the medical countermeasure research and development where there's weak clinical research capacity. There's a number of priority areas for future research that are especially relevant to infectious diseases. One health, including zoonotic and vector-borne diseases and antimicrobial resistance. Planetary health, which includes climate change and the effects of climate change on health. And then implementation research, the science of what it takes to promote uptake of evidence-based interventions and moving them into routine practice. And so from our perspective, from Fogarty, we really see strengthening the research capacity in low and middle income countries as a key priority. We focus on human capacity and training. It's critical to provide protected time for research with international mentorship and networking. This is how people get developed into their research careers. I'm happy to be leading an international collaboration called Essence. This is coordinating funders of research capacity building in developing countries. And we're now using metrics. We're looking at the national number of clinical trials and publications to help us increase the efficiency and the equity of capacity building and engaging the national stakeholders to help with the research on their priorities, as well as the global public good of pandemic preparedness. I'm very happy to see this use of metrics to help drive the capacity building as an element of pandemic preparedness taken up by the Global Preparedness Monitoring Board and the Global Health Security Agenda. Some of the other themes that Larry has mentioned, just the remarkable advances in the way we do research with COVID-19, the use of digital platforms, including today, the remarkable global collaboration that's facilitated through these platforms, and the very rapid publishing and use of preprints. We need to continue to capture the best of that going forward. Addressing the infodemic, there's also a research component to that we need to embrace. And then we have seen, it was mentioned in the discussions this morning with Barbara Bush, about really new perspectives on what we would consider real capabilities in terms of the COVID response. We've seen some stronger responses in low-income countries in the global south. And so this is really accelerating the decolonizing and democratizing of global health. Just lastly, encourage everyone to connect with us at Fogarty, subscribe to our funding newsletter, and see us on social media. So thanks, and I look forward to the discussion.
Thank you very much, Peter. We're going to move now to Margaret, Dr. Gyapong, for her presentation.
Thank you very much for the opportunity. Can you see my screen?
Yes, we're fine.
Okay, great. Thank you. Thank you very much. So basically, I'm going to introduce the institution to which I belong, the University of Health and Allied Sciences, and unlike my previous colleagues who spoke, whose institutions have been there for several years. Our institution is just 9 years old this year, and we are are small, but we really think big. Currently, we have 7 schools and 2 research institutes, the Institute of Health Research and the Institute of Traditional and Alternative Medicine. The Institute of Health Research is putting together the policy, setting activities in the various schools. Now, the main vision of the university is to become a preeminent research and practically oriented health educational institution dedicated to community care. Let me indicate that we are the only universal health and allied health professionals for the Ministry of Health and the Ghana Health Service. Now, in terms of research, our strategic objective 1 basically is focused on research. And our aim is basically to push the limits of our academic curiosity in health research so that we can earn an enviable reputation for the wide-reaching impact of our research on the knowledge and practice of health and well-being. So we really are not interested in just doing research for doing sake, but we want to make sure that it has an impact on the people that we serve. It has an impact on the people to whom services are delivered. And so we work very closely with the health system. We work very closely with the district health administration. We work very closely with the Ministry of Health. In terms of research, we do research from the lab right down to the field. So we are involved in a lot of laboratory research from our School of Basic and Applied, Basic and Biomedical Sciences, our School of Medicine, our School of Pharmacy does a lot of laboratory research. We are involved in clinical trials in our School of Public Health. We are involved in epidemiological studies in medicine and even in the Institute of Health Research. And of course, health systems and policy research and implementation research. And we happen to champion this for the African region also. Now, we don't do this in isolation. Many of us who have moved into the university previously worked in the Ministry of Health, and we worked in the research division of the Ministry of Health, and we brought quite a lot of experience to bear. We partner with our other colleagues in the University of Ghana, KNUST, the Ghana Health Service research centers, and the various disease control programs, so that as we teach our students, we are able to bring practical issues to bear so that they can choose research topics that are relevant for various disease control programs. Now, in terms of infectious diseases, our focus on COVID, it hit us hard. It hit everybody hard. Our first case was early March, and then we had the spike around June, July. Things calmed down a bit, and then we had the second wave. Currently, things are calming down a bit. As of this morning, we have 49 new cases, and in total, since the beginning of the pandemic, a total of about 779 deaths. So what were the opportunities in the midst of COVID? No flights were coming in, no imports were coming in, no visitors, no collaborators were coming in. And one of the big opportunities we had in country was government's commitment and the multi-sectoral approach to dealing with these activities. Now in Ghana, we have public health reference laboratories across the country, and we have quite a strong public health system for surveillance and contact tracing. And so we use that opportunity to be able to track down cases, to be able to isolate them, and also to be able to do some testing of people suspected to have COVID-19. But more importantly for us was the strong research institutions in the Ghana Health Service and universities with overseas collaboration. And our colleagues with all the capacity that had been built over the years with partners in the North, with the setting up of laboratories and setting up of various technologies in our labs. Some of our colleagues were able to do some genome sequencing, the first time ever had ever happened in the country. we were able to do genomic epidemiology, some sero-epidemiological studies, drug discovery and modeling, and some social science and implementation research. Now, what were some of the challenges? Now, even though I talked about the public health reference labs being able to do some of this testing, there was weak capacity to do PCR, even in the reference labs and even in the research labs. And so some of the more experienced colleagues in the universities had to put in a lot of efforts to do training. Of course, we had to really reconfigure some of the gene experts equipment for TB diagnosis to be able to do COVID-19 testing. And so we became quite innovative in the way things were going on during the COVID-19. Our research labs are currently doing routine testing for COVID-19, and with collaboration between and within institutions, there's a lot of capacity building going on, sharing of equipment and supplies, and we are seeing a better collaboration between the health service and our research institutions. So if you want to get in touch with us, this is our email address, and we, like I said, we are really focused on research. We have the policies to go with it in terms of intellectual property, and we are always welcome to collaborate more with our partners on this panel.
Thank you so much, Margaret. I enjoyed hearing a lot more about your organization. We're going to move on now to Bruce Gellin for his presentation.
Thanks a lot. Okay. Well, Larry, congratulations on your anniversary.
Thank you.
But even more so, congratulations on this panel, which, you know, when you and I talked about this as it was being put together, it's quite an array of institutions with a number of different approaches to infectious disease research. So we'll talk more about that. Sabin, which was named after Albert Sabin, it was put together in his memory, actually the year that he died in 1993, is focused primarily on almost exclusively on vaccines and the things that support vaccines and immunizations. So that's been our take really from the beginning. The structure, and I think that probably this audience will appreciate that, you know, there's a vaccine world and a vaccination world, and they don't always speak the same language, but they clearly are connected. And at Sabin, we're trying to embody again what Albert Sabin had was, you know, the not only the science but the advocating for access. So the two components are an R&D portion and something that's more about global immunization with a focus on lower and middle income countries. The brand that we have is the array of these things, and there's an overlap obviously with many on the panel of advocacy, evidence generation, education, capacity building, and thought leadership. We have a number of programs that I'll get to in a second, and you'll see how some of those portray. But I just want to give you a snapshot of the R&D piece and then a snapshot at a high level of the global immunization piece. Again, the focus is on lower middle income populations and to develop vaccines with that in mind. Sabin relaunched its R&D strategies just a few years ago, and the approach was to look for candidates for where already some risk was taken away, where there was some existing clinical science, existing research, and things that could be moved along. The idea then was, you know, another version of a public-private partnership, and even from the beginning, this was seen as sort of a virtual way to do this. We don't have the entire bench of in-house researchers, but those who are going to be able to guide the different aspects of vaccine development with the range of partners that you know about that are needed for the development part. And then the current project, which has gotten more interesting now that adenoviruses have been in the news, is the chimp adenovirus, Ebola, Sudan, and Margaret vaccines that we're working on under contract from BARDA. And Larry, you and I can talk about some of the involvements of Texas as well. On the global immunization side, this is a very busy slide, but that tells you about what we're up to. There are a range of different programs, one on vaccine acceptance and demand, one on the boost community, which you heard about from Jen Seiler earlier today, which was the 1,500 member network of the people who lead immunization programs at national and subnational levels. Applied epidemiology, which is really taking the evidence from epidemiology. It's been focused primarily on typhoid so far, and trying to think about how that evidence can be developed to help country programs make decisions, and another project which we refer to as the influencer, which I'll talk about in a second. Again, there's an array of other things going on here. We don't have time to talk about all of them, but again, all these are in service to immunization programs in the support of lower and middle income countries. I just want to give you one snapshot, and I think this summarizes some of the things that this symposium is about. And I'll just talk about it in terms of innovation and the need for taking on new challenges and looking at things in new lights. Larry, when you talked about the way that you responded at Texas Biomed to the challenge of COVID, you said you got everybody together and tried to figure out from all the different disciplines where you could take the advantage of it. We took a look at this a few years ago. We have a group called the Sabin Aspen Vaccine Science and Policy Group. It's almost like a think tank, but takes on a big challenge every year. I'll tell you some more about that, but trying to look at the challenges of universal influenza vaccination. And it coincided with the grand challenge of creating a universal influenza vaccine. I think the summary there, and this comes from that call for the challenge, is what we're trying to accomplish. And I think this is something that, again, Larry, I think you mentioned this before in terms of your multidisciplinary problem solving, because we're going to need that. We're going to need everybody to come to the table, because probably not everybody realizes they may have a solution to a problem unless they see that problem in front of them. So this is the way that grand challenge was positioned to encourage interdisciplinary collaboration and cross-fertilization of ideas within and without the outside people from left field, not just right field. See completely transformative approaches rather than incremental research to try to think, where is that aha moment going to come from? And again, this idea of collaboration and how we might structure science for serendipity, put it that way. So that was that's sort of that bred a separate stream that was referred to as the Influenza Initiative, to try to think about how we foster this kind of cross-disciplinary collaboration to take on big problems. This advertisement for a coming attraction. The Sabin Aspen Group will be releasing this report next week, and it's taken a hard look at the R&D ecosystem. We learned a lot about this year. We learned of things that work in a way that we didn't imagine they could work so well, but at the same time trying to think through how does that get restructured so that to make sure it's ready to go and as efficient and as effective as it could be. So I'll just give you this as a promo. Next week, we're relaunching this report. There's a webinar, and you can see the dates for that and where to register. But again, it's about the R&D ecosystem and trying to think of how that's going to be, best equipped in the future to have all the resources and all the interconnections and all the collaborations that we need. You asked us to take a look at this from a big picture standpoint. I've stratified this a little bit in terms of the way that we look at it at Sabin from both an immunization program perspective and an R&D. I think a couple of things that we've learned here. So among the challenges are this is a very crowded space in many places. And while some of that is competition, I think it also encourages everyone to figure out where their niche is, where they add the most value, and how to bring that to the table. A challenge that we've all experienced is how to deal with this virtually. And I think we've learned not just that we would all otherwise be at San Antonio today, but we've managed to do this. And I think we're going to continue to figure out how best to operate in this kind of space. It's the new normal. We just don't know what it's going to look like. As I mentioned, the challenge and also the opportunity of multidisciplinary problem solving, funding works its way into both of these categories. On the R&D side, R&D virtually is a little bit different than everybody in the labs together and how to manage that. The issues of regulatory harmonization, Larry, I'm glad you focused on some of the animal work and the role of animal models in addressing some of the scientific challenges. And then again, on the R&D perspectives, how to look at this from a global perspective. And I think it's also a snapshot of what we're seeing now with global equity, given the disparities in supply. A couple of other things to touch on as far as these opportunities, I think to me, one of the important themes here, in addition to innovation, is partnering. None of this can do us by themselves. And how do we best partner strategically? How we best forge the best collaborations using the current programs that we have. I know that Jen covered this topic of adaptive leadership, but it's also the leaders of tomorrow, wherever you sit, to try to think about how you solve problems, how you work with the people below you, next to you, and above you in a way that's going to be as resilient as possible. And then finally, I think that what we're seeing, I think in outside of this today, and this questions of the infodemic that Peter mentioned and vaccine hesitancy, the opportunities to demonstrate the value of vaccines. And again, the importance of collaboration. So let me stop there. And I know, Larry, that we're gonna hear some more from other institutes, and then we'll have a great discussion. So thank you.
Thank you so much, Bruce. Really appreciate your perspectives on that. And last but not least, we're going to hear from Jüerg Utzinger about his institute and their contribution. Thank you.
Thank you so much, Larry, Margaret, and colleagues. It is truly a pleasure to be with you, and simply fascinating to see and to learn. We are all different institutions in different geographical space, socio-cultural settings, and yet very similar visions, very similar approaches to solution-oriented options. I think we can say we are one. What I would like to present is very briefly about our institute, the Swiss Tropical and Public Health Institute. Brief history. You see, we were founded in 1943, in the midst of the Second World War, a time of maximum isolation, maybe a little bit similar to the current global pandemic, where we also see separation. In 1992, we integrated the Institute of Social and Preventive Medicine, therefore bringing on board very broad public health, social, preventive medicine, integrating. This was visionary because many of the issues then we were focusing in Switzerland, in Europe, became themes also in low middle income countries. Basically, the Institute has been in the space of global health for the past 77 years. Therefore, maybe we could say we are the small brother of the Texas Biomed, because we are just about 3 years younger than Texas Biomed. We combine research, education, classical academia, but then also service provision for our local communities, vaccination, travel advice, but also services for low middle income countries in partnership, strengthening health systems, you name it. Since the founding, a strong emphasis on low middle income countries. Was very interesting to hear from colleagues. Many also are having a particular emphasis on low and middle income countries. Last point, we have now more than 800 employees, students from more than 80 nations. Diversity, inclusion is really crucial for our institute, therefore moving forward with partnership. We have just renewed our strategy, very simple. We have a vision. We want to make the world a healthier place. Since the beginning, 3 strategic goals: excellence in science, taking science to impact, not just doing science research for the sake of research in the ivory tower, taking it to impact, very similar as we have heard from other institutions. Finally, mutual learning for sustainable development, knowledge circulation, finding solutions together for sustainable development. The Institute pursues a broad range of research. We have currently more than 300 active projects in more than 100 countries, and we do year after year across groups, across units, across departments, review where we stand. This helps to break up silos, again, solution-oriented options to tackle some of the key global health challenges. Guiding principles, cooperation, partnership is crucial. Taking science to impact, it is, as I said, not for the sake of doing research for research, but making an impact, improve people's health and well-being. Sustainability, inclusion, and diversity. Our staff are courageous. Many of them have dirt on the boots. They are close to where the issues are. Final slide, challenges and opportunities. I do not have much else to add than what our colleagues already said. However, I think we live and see a very rapid epidemiological transition. Infectious diseases, non-communicable diseases, many places in the world. Anthropogenic changes, climate change, natural resource exploitation, biodiversity losses, all very major challenges, and we can only tackle them together. Anti-science movement, we have heard it. Some of the opportunities, I very strongly believe the 2030 Agenda for Sustainable Development provides a framework, a shared vision for one world. Partnership is crucial. Only together we can solve some of the global issues. Communication is key, taking science to policy. Communication, this panel, I think, is a terrific way of really bringing multiple constituencies, multiple people from different socio-economic settings together. We communicate, we share one vision. Over to you, Larry.
Thank you very much, Jüerg. I'm excited by your presentation and those of others. You know, if we were to take everything we just heard, you would think there are no barriers or borders. In fact, we seem like we're one family with very common goals to eradicate major global health threats, in this case, in this setting, infectious disease threats. Yet we know that's not reality. We know that there are some challenges here, and we've heard about some of those, including capacity building and this concept of decolonizing and democratizing some of the challenges we face. So I want to drill down a little bit more on that, because I'm thinking about this pandemic as a game changer, not a moment in time, but a sustainable game changer. And I'm looking for what's different, how can we do this differently? So I know that's a really narrow question I'm asking. But Peter, maybe I'll start with you. You come from a huge, incredibly powerful platform at the NIH and the Fogarty Center, and you touched on this in your presentation. What's going to be different? How do we see it differently, and what are some of those biggest barriers to us coming to common ground?
Yeah. Well, thanks, Larry, and thanks for getting to the heart of the matter. I think one of the things that we've seen is that with the emergence of SARS-CoV-2, China had this very strong, robust research capacity, so was able to share the sequences for the virus, recognized relatively early on, shared, and as you know, able to go quite directly into the development of the diagnostics and the vaccines. And we have seen there has been quite a bit of collaboration, the active partnerships with NIH and other agencies, many private sector pharma companies, including international companies, has been a big part of it. The ACT Accelerator with WHO. In the Solidarity Trial, there were 30 countries, including 16 from low and middle income countries that participated. So all of that collaboration and global collaboration is a huge advance. But what I think we're seeing, and what I touched on, is again, look, we can now make a map of the world and see where are the countries, where are the areas of the map where we don't have that research capacity. And if SARS-CoV-3, COVID 2022 comes from one of those areas, we really will be standing us in good stead to develop that capacity. So we have that prepared and ready when there is something emerging.
Yeah, very important. Bruce, you want to contribute to this conversation?
No, sure. So I think Peter laid it out nicely in terms of the collaboration. I think from the beginning, we've heard everybody from every sector say that collaboration has been unprecedented, and it's been perfect. So I think it's an opportunity to take a look at that, see where it's worked well, and also see where it hasn't worked well, to see how we can we improve that, because that's going to be central to it. I think the other, as you raised, Larry, I think the other thing is, sadly, because of the devastation, both human health and the social and economic, I think get what we've been saying for a long time, that like this will happen. And when they do, they're not just a health problem, but they're a whole society problem. You know, I spent a long time, and Peter and I spent a long time from a government standpoint looking at pandemic influenza preparedness. And it was pretty clear that these are the kind of things that could happen and spill outside of just health. So my hope is that this is not another one of these sine waves of the neglect and crisis and neglect cycle, but now the recognition that, you know, as an insurance policy, we need to make the investments in the things that we all knew needed to work when we needed them, and not to cobble them together in a crisis. Whether there's the appetite for that, we'll have to see. But I think there's a recognition that this could happen again, and it will happen again unless we pay attention to the whole range of things and the structures that need to work better.
I welcome Jüerg or Margaret to contribute your thoughts to this. Yeah, Jüerg. You're muted.
Okay.
Margaret,
Margaret? Go ahead,
first.
Margaret.
Yeah, okay, I'll go ahead. I think one of the things that happened in Ghana was the fact that we shocked ourselves at the things that we could do. Most of the time when there's a problem, we sit and wait for somebody to bring the help. But this time the borders were closed. Nothing was coming in and nothing was going out. And suddenly we had to rethink our strategies. And then people realized, oh, we are capable of doing A, B, or C. And so we had to really set ourselves working. But of course, we had these collaborations from the past. And so even though people were not coming in, you could engage through Zoom to be able to discuss opportunities and what to do in the face of any difficulty. But then the other thing is this whole issue of what to do in the face of the pandemic, and realizing that one size does not fit all. So if we say social distancing, in Ghana, we have all these funerals and marriage ceremonies, and where people are just hugging and gathering together. How do we socially distance? And then we keep spreading things around. So it was a bit tough, but then the whole thing of, now that the borders are slightly opening, still partnering with institutions that we have partnered with in the past, and then learning to understand which other institutions we can partner with to be able to deal with some of the gaps that we have identified that we have as a result of doing what we're doing in the midst of the pandemic.
Yeah. Jüerg?
Maybe just a few points to add. I think what we have seen is really also the power of open science. Has been said, the genome sequence made available, and within an unprecedented amount of time, multiple vaccines are on the market, gone through the full preclinical phase 1 to phase 3. Totally unprecedented. The partnership is key. I think everybody dwelt on that. Maybe to get prepared, really much more robust, integrated surveillance, public health response systems. And the final point where I think we miserably failed is, okay, we are now ready to get these vaccines or other issues. They are currently a limited global public good. And how can we make sure that the distribution access is more rapid, is more equal to all those in need?
Yeah, I mean, you're touching upon this concept of vaccine nationalism, which has been a challenge. Now, I think it's changing. We all understand we hear about what's going on, for example, in India right now, but you know, we're not over this pandemic. We have an opportunity with the vaccine. You know, there's always the interface of public health and politics. And that's challenging. And what I'm thinking about, or what I'm wondering about, is I have on my desk an article. I think the senior author is David Bloom in the Proceedings of the National Academy of Sciences from 2017, and it's the inflection curve of infectious diseases, and it's beautifully written, and it shows you history tells us that in 2 years the curve goes back down. And we've got all this passion today in this panel and in this symposium, but I'm fearful that, how do we change that? So a little bit came out early today with Barbara Bush. Do we need to mobilize ourselves differently? Do we need to think about how we impact politics differently in a proactive way? Now, Bruce, you've enticed us. You tell us this incredible document is coming out next week. Is any of that in there? Do you have any thoughts? Because again, this is a provocative discussion we're having to try to change the trajectory in some fundamental way. Now, we haven't had a pandemic for quite a while, so maybe this will. But what are your thoughts on that?
Just briefly, I mean, it speaks to the R&D ecosystem primarily, and one of the concepts, and Nikki Lurie and Jerry Kirsch wrote a piece for it that actually similar thinking was elsewhere. They refer to the conductorless orchestra, that there are all these pieces that go and do their things, but they had to then be put together because there weren't existing structures to do that. COVAX had to be created. Thinking about a manufacturing base had to be thought through. So I think the idea, one of the things that comes from that is, hey, let's get everybody in a room and think through roles and responsibilities so that some of that is pre-wired and you don't have to then figure it out at the time, figure out how you're going to get money, and then figure out how to spend it. I would like to speak to one of the comments that you mentioned. I thought it's true. The tsunami of science has been unbelievable. But I think that's where we, on the science side, can help and do a better job of translating. We're all used to the scientific method, which means, somebody publishes something and next week it's just the opposite. And sooner or later you get to truth. The people looking at this think the experts are idiots. They don't really know. So I'm going to make my own decisions. So I think that watching science in real time is not for everybody. And so I think the opportunities to maybe, if you can so-called teach the scientific method, but let people know that that there will be changes. There will be shifts. I'm struck, and I think what didn't happen in the United States this time was what's happened in all of my experiences at the beginning of the pandemic, where the head of the CDC would come forward and say, hey, here's what we know, here's what we don't know, here's what we're working on, here's what we think you should do about it. But know that as new things happen, we're likely to tell you different things. Because that didn't set the tone at the beginning, it's all this, hey, you told us that last time, why should we believe you now? So I think there's something in this tsunami of science and how we're all comfortable with this, but how we can maybe help to educate others to recognize and set expectations in the right way.
What do you think about this education strategy, Peter? Do you have any thoughts about this that Bruce is talking about?
I think also part of our education as scientists, we need to be comfortable as communicators. That in some of my previous roles, when I or my colleagues were asked to communicate, we were, said, no, we're scientists. That's not our role. We don't know how to do that. And it is our role. We need to learn how to do that and to be able to, we should be the smartest people in the room. And the one approach is just to counter the misinformation with the correct information. It's very complex. Another great Texan, Peter Hotez, has been very strong on this and identifying some of the very complicated and kind of malign aspects of this. But at a minimum, as part of our science education, we should be educated as communicators.
Absolutely. How about that communication education piece in Ghana, Margaret? How does that work with regard to your environment and the general community? I loved you talked about how difficult the concept of social distancing was given traditions and activities in your environment. Were there enough scientists talking out, communicating effectively? Do we need to do more?
In Ghana, like I talked about earlier on, there was this strong partnership between the scientists and the health system. working together and everybody knowing what their role is, and then sharing information so that the people responsible for particular things knew what was available and took that information and used it. So for instance, we are doing the evaluation of the malaria vaccine, but we are learning lessons from it for COVID. So you have the health communication unit of the Ministry of Health that needs evidence from what is going on to be able to design their communication messages. So there's a committee that is formed, which includes people from research, clinical research, social science, health communication, those in the lab, sitting together at the same table, discussing how do we move forward with it. So once the evidence is presented, those whose role it is to take it up and share the information are doing it. Now we are learning new things about social media, because that is where all the rumors and the misconceptions were spread. And so a lot of the messages in health, dispelling the myths and portraying the truths, are also going in social media, and these are being shared. It has been very tough trying to keep people away from each other. Our funerals are huge, like I said, but then there are rules about the numbers of people that need to attend funerals. So what is happening is people are burying the dead, waiting for COVID to pass, and then have a big funeral. So people are just anticipating that, oh, it will come to pass, and then we'll have the big funerals. Last year, you found a lot more people paying attention to wearing the nose mask and.
I'm sorry, you froze, Margaret.
And I'm not.
Can you repeat it, Margaret? Can you repeat, Margaret? You froze there for a little bit, so I missed your. We missed your last point.
Okay, so I was talking about the fact that people have buried their dead quickly and are waiting to organize the big funeral where entire families and everybody comes together. You think we would have learned that we are in a difficult situation, let's do something small. But that togetherness, that bond that brings us together is still there. And people are like, I haven't done the proper thing. I haven't given my dead person a befitting burial. So let's just bury the person quickly, but then we'll have the funeral later. So yes, we've learned certain things and we've changed in certain ways, but in other aspects, we know that the pandemic will pass and then we'll go to business as usual, which is a difficult thing to be able to handle, but that's the reality of life and human behavior.
That's the point, isn't it? There's this whole period that's going to happen with this head back towards normalcy where human behavior, social behavior, what's going to happen? There's going to be an incredible rebound, if you will, a period, an aftermath. And, related to that, I want to know if it's just my concern or others have concern on this panel. I am quite concerned about the idea that the public health infrastructure is not big enough. And we have diverted resources into COVID-19 from other scourges of our time. Drug-resistant tuberculosis continues. And that is the classic airborne infection where an index case of tuberculosis can infect 15 to 20 others. That's rampant, still continuing today. We have HIV, we have malaria resistance, vector problems, and we're diverted. We're all focused on COVID-19. Is there going to be a problem in terms of some of these other scourges in the aftermath as COVID-19 will ultimately come under better control? What do you think, Bruce? Do you think that's, a real problem or just,
It's absolutely a real problem. I think that, and we'll start to see it. I just saw a piece today that about just routine childhood immunization in the United States is way off. And we know that that's the case in many other places for lots of legitimate reasons, but nevertheless, it's still there. And you can, I do worry about the explosions that we're going to see of things that didn't happen because of the lack of mixing that are going to happen. But then I think importantly, particularly this group, is what does that mean for the research agenda and to be able to continue some of those things. I think that for sure there'll be these public health issues that bubble up. We can predict all of them, but I think at the same time, how is this affecting all the other things that you mentioned that were equally important the day before this started?
Anybody else have any thoughts on that topic? Yeah, Peter.
Just to pitch in, I think definitely in these public health programs, as you mentioned, HIV, malaria, tuberculosis, vaccinations, we are seeing big hits to those programs, reductions, especially in the resource poor settings. There are some lessons learned and some silver linings. For example, in HIV programs, they're learning to have people come back instead of every month or even every 3 months, to come back once every 6 months for their medication refill. So that there are some innovations coming out of this. And in the US, it's really underscored how our public health infrastructure and workforce had degraded even since the 2008 financial crisis. We never really built back our public health workforce, which was a large part of the reason why we did such a bad job with the contact tracing that actually many African countries did quite well with. And so we're now slowly building that up, and we're seeing in the new plans from the White House and the new funding a commitment to a 100,000 strong public health workforce. So I hope, at least in the US context, there'll be an actual, over the longer run, a benefit. And as COVID comes under control, that same workforce can be engaged with HIV elimination as a public health problem, which we've been committed to, vaccinations, diabetes, other non-communicable diseases.
Right, and let me just say, I love the word communicable and non-communicable, because my whole shtick, if you will, is they're related. They're related. We need to be thinking about the triggers of an infection that result in a variety of inflammatory diseases, including the non-communicable diseases. They're not independent of each other. It's kind of I think, an important point. Margaret, you wanted to make a comment.
Yeah, I was going to say that Peter actually hit the nail right on the head. And I've always said that if COVID were left to just clinical care, I think many more people would have died in Africa and in Ghana, because our clinical services do not have the capacity, the equipment, and the supplies to deal with the kind of critical cases that arrive in the hospitals. Our intensive care, nothing to write home about. Thank God for our public health systems. And that is what we have been used to. And I think that is what has helped us quite a bit. Community health nurses going around all over the place, visiting homes, immunization systems with coverages above 80%. I think that is what has helped us to a certain extent. And we really need to strengthen those systems. And I'm glad Peter has mentioned the increase in funding to be able to ensure that that system is strengthened in the US and in other places.
The reality is we're grossly underfunded in this sector, grossly underfunded. And thinking about strategies to enhance funding, I'm very powerful, Peter, in your presentation about the percentage of funding and the increased attention to global initiatives. As an NIH, a longstanding NIH, funded investigator, the work we're doing in South Africa and at the border with Mexico, these are critical aspects, more and more interface between discovery-based research and the field and humans. So we need funding as a major issue. I think I interrupted Jüerg, though. He wanted to make a comment. You look like you wanted to make a comment, Jüerg.
I would, if I may, I would just like to come back a little bit also on the issue of communication. I think it is a common theme. I very much like Bruce and Peter, how you challenged and also said that we need effective communication. I give you an example from Switzerland. Switzerland built up then quickly a so-called Swiss National COVID-19 Science Task Force. It was kind of an ad hoc with about 70 members. Now you can imagine 70 members and they all are the best scientists. So you have information in all kind of directions. At one point, the politicians then wanted to even have a vote to say the Science Task Force is not allowed to speak openly any longer. I really believe the social media plays a crucial role here, because you have a small discovery and you pipe it out to the world. And in an emerging pandemic, also the information changes, the evidence changes. If you look, for example, at the face masks, even WHO at the beginning said it's actually not useful, and it changed over time. But what I think is important also that the scientists realize they do science, they generate the information, and of course it changes over time as the evidence grows, but they provide advice, scenarios, options to the politicians, but in the end, it's the politicians who make the decisions.
Yeah.
And I think this was a little bit of a misconception once in a while, that all of a sudden you think you have the discovery and you can tell the world how you need to react.
We have a few minutes left. I'm going to, I think I'll ask this question, although it'll be incredibly self-centered. Let me see if I can find it again here. Okay, so Al Rajwani is a new member of our board of trustees at Texas Biomed. He's a relatively newly retired senior executive at Procter & Gamble, working primarily in India. He chose to settle in San Antonio, Texas, and has been wonderful for us in thinking outside the box and on a global landscape. He says a key objective of Texas Biomed is to grow our awareness and to develop sustainable equity on a global level. And currently, we're very well known locally, but not beyond that. And I think you all know that because several of you may not want to admit this, but you didn't know anything about us before this symposium today. Do you have any thoughts or objectives as to what we should be thinking about? And let me backdrop it by saying in 2017, we launched a one-year strategic planning exercise, which then led to a 10-year vision, which was approved by the board in 2018. And we're early in that. You know, we're discovering where we want to go in the infectious disease realm. We're laser focused in this arena with our resources. But given the discussion and some of the challenges we face, any thoughts that would help us as we think about our future together in a global world?
So first of all, I want to thank him. I mean, here you have the hand washing king. So that's an important part of all that. So thank you for that. I think what you've done with this panel is your pilot for this. That you've probably reached out to all kinds of people, but you've put together an array of very different types of institutes that have a focus on either a principle or a significant focus on infectious diseases. There are others, so maybe this is where you put a network together. I mean, just in the last hour, I've got ideas that I'm going to reach out to everybody else on this panel about things we can do together or to share experiences or to share things that didn't work out. But I would think that what you've done today is your pilot, which I think is it tells you that you should, you should continue that and build it out and have a network of these institutes.
Great. Thank you so much for that. Yes, Peter.
I'm going to give a self-serving answer to your self-serving question. You have an amazing institute. You have an amazing story to tell of the successes that you've had and some really world-class capabilities. What I would love to see is, as we really grow this global collaboration, is that you start partnering with these other global institutions, like with Margaret in Ghana, and you bring people, let them come and spend a year with you and learn from you, and then go back to their home institution and continue that collaboration. So I think that would be one way to really tell your story and to build your network and to build the global research capacity.
Thank you very much. I really appreciate that. And our new VP for development, who you'll hear at the closing, Dr. Akudo Anyanwu, what an incredible opportunity for us, given her sphere and her interests in global health and her work in Africa in particular. So yes, thank you. Great suggestion. Yes, Jüerg. I think we're going to have to stop in a moment here, but go ahead quickly.
I'll be very brief. I think we are all too old on this panel. Now you have a lot of young people, and I was very pleased that we could bring in a few of our students. Why don't you now exactly pose this question? Ask the young one, the next generation, how to do it. Collect the ideas, write a piece about it, let them write it, and then they drive it forward.
And I think we'll include Barbara Bush in that, actually. Margaret, you get the last word.
No, I mean, Jüerg just hit it right on the head. one of my students was chatting with me whilst we were talking, and I told him, the next time I'm called onto a panel, I'm going to put you on. And he said, no. I need to learn a bit more. I said, no, learning time is now. So I couldn't agree with Jüerg more. Let's get the brains of the younger ones and let's put them together. They have ideas, but they think they are not ready. They are ready, and they can move in and be able to do a lot more. They have the energy, they do social media, they do all kinds of things, and they can change things around. Yeah.
Thank you very much, Margaret. Well, let me tell you, I'm very energized. I have new friends and colleagues as a result of this symposium. I feel like there's so much opportunity, and we are a very important element of the force of change. And yes, not just our generation, but the young people, but we need a force of change. We need to change the way we think going forward. And proactive is the answer. It's been touched on by many of you. And I'm optimistic, that we are in a society today that can make a difference for the future of our children, grandchildren, etc. Thank you so much for your time. I certainly hope you come back tomorrow. But I've enjoyed this, and I appreciate all your thoughts. Thank you very much.